Hello, welcome back. I'm Adam Rosen. Today I want to talk to you about kneeling after total knee replacement. Now, one of the things that we commonly talk to patients about at the time of the discussion of what the surgery entails and what are the normal expectations is that a lot of patients can't kneel after a successful total knee replacement. Why is that? We're not really sure because if you go back, there was sort of this mantra, this gospel that one of the rules when knee replacements first came out was patients should not kneel on the knee. There were a lot of rules, and there wasn't any science behind it. You could play doubles tennis, but you couldn't play singles. And now, as we've gone on, there's a lot more data that lets us know, what you can do and what you should or should not do. But kneeling was one of those things I can only assume was just an educated guess. Don't kneel on this implant. You don't want to damage it. And what I found over the years is talking to patients and forewarning them that you may have trouble kneeling after a knee replacement. A lot of them couldn't, but a lot of them could. In my practice, my best guess, I didn't really look at this, so I don't have a number. I would say it's 50-50, that some patients could and some patients couldn't. And for the patients that couldn't, I would tell them sort of the standard stuff. Use a knee pad when you kneel and try to make sure you're on a soft surface. Get some type of cushion that you can use to kind of put down, and that would protect the knee. Well, about 2 or 3 years ago, an orthopedic surgeon in Chicago, Dr. Richard Berger, produced this paper, and it was this really, I like the elegance of simplicity sometimes. So he had this very simple study, and when he looked at, he found that a majority of his patients after knee replacement could kneel, but there was a bunch of patients that couldn't. And he put together this very simple trial study, and what he found at the end of the study was almost all, about 84% of those patients could kneel. So what did he do? What was the magic protocol? And it was nothing fancy. It was just 5 weeks, and this is a protocol that I've written out for my patients and I share with my patients. But basically, week 1, you're going to kneel for 10 minutes every day on the sofa. So you're putting pressure in a very, very soft setting on the knee. The second week, again, every day for 10 minutes, you're going to take that sofa cushion and put it on the floor and kneel on that. For the third week, you're going to get either thin cushion, or if you have a very plush rug, you're going to kneel on that. So each week, you're going from something soft to something harder. And again, 10 minutes each day. The fourth week, you'll do a thinner rug. And on the fifth week, you'll spend 10 minutes every day on your knee, kneeling on a hard surface, like a hardwood floor or a tile floor, something hard that you can kneel on. And again, what he found was 84%, so almost all of these patients were able to kneel in some form or fashion after going through this, what I describe to my patients as sort of a desensitization protocol. You're just getting used to kneeling on it, because in the past, people would say, oh, I kneeled down once, it hurt, I never did it again. And this way, you can practice this over and over again in a very synchronized manner, going from soft to hard. And you should find, hopefully, that you can build up that tolerance and the ability to kneel. Now, always check with your surgeon. He even puts in his paper that it's not recommended early on while the wound's healing. I have an app-based program that we used for therapy, and this usually gets pushed to the patients around the 3-month mark. By then, the wound is mature enough that I don't believe they should do any damage, but I would never recommend this early on when the wound is still fresh or the wound is still healing. So again, that's a little 5-week protocol. I'll even put the link in the show notes if you want to look at the study, and you can check that out. But week 1 through 5, 1 on the sofa, each day 10 minutes. Week 2, sofa cushion on the floor. Week 3, thin cushion or plush rug. Week 4, thin rug. Week 5, and a hard surface. So thanks again for listening. If you like all of this content, if you do listen to podcasts, you can also follow my podcast, Your Knee, Your Health, which you'll find on most platforms. Once again, thanks for listening. I'm Adam Rosen, and until next time, stay safe.